Hi, my name is Leah Campbell, and today we're going to be exploring the status of HIV in the US, Germany, and Cuba. So, HIV and AIDS are a serious autoimmune disease. It begins as HIV and progresses into AIDS. It's transmitted through blood and sexual contact and has had over 35 million deaths to date, so it's a huge issue. HIV testing is really important to make someone aware that they have the disease. Condoms can be used to prevent the spread of disease through a sexual contact, and antiretroviral therapy prevents HIV from progressing into AIDS. So, of our three countries, the United States is the wealthiness, and it spends the largest percentage of its wealth on healthcare. However, health outcomes don't line up with this trend. Germany actually leads the pack in terms of life expectancy and infant mortality rates, but all of the countries are relatively comparable. So let's get into the healthcare systems. The US healthcare system, its strengths are that it has many different options for Americans to choose from. However, its weaknesses are that it doesn't always have the best access to coverage. So the German healthcare system, it also has state-of-the-art facilities like the United States. That's one of its strengths. But another one of its strengths that's different from the US is that it does have mandatory public health insurance called the sickness funds that provide universal health coverage. The Cuban healthcare system is the closest to a socialist healthcare system we're going to be seeing today, and it's similar to Germany in that it has public universal health coverage. However, it is different with its public delivery and its capitation payments. That's new. And the Cuban healthcare system has a strong focus on prevention rather than treatment because it doesn't always have the resources available for treatment, being a lower income country. So in the US, the Ryan White HIV/AIDS program provides care to low-income Americans. We have a few disparities. The southern US is the hardest hit, and cultural homophobia has created stigma around the disease. In terms of treatment of the disease and prevention, local health departments perform community outreach with mobile testing and contact tracing, and incidence has been reduced two-thirds since the height of the epidemic. In Germany, we also have some regional disparities with rural areas being hardest hit, but there are some disparities between migrants and non-migrants. Again, homophobia has created stigma around the disease. And similar to the US, there are some mobile testing units that are run by the agency AIDS Hilfe Krefeld. And 99% of Germans that are diagnosed with HIV are receiving antiretroviral therapy as a result of that universal health coverage. So, similar to Germany, antiretroviral therapy is provided free of charge in Cuba. Like the other two countries, we do have a bit of a regional disparity, with Havana being the hardest hit. However, some unique things about Cuba is that it really has a standout sex ed program in schools, and it also has an optional quarantine for positive individuals, which we'll get into a little later. And it was the very first country to eliminate mother to baby HIV transmission, which is incredible. So, in terms of incidence and prevalence, Germany has the lowest rates and Cuba has the highest, with the United States falling in the middle. And in terms of HIV positive individuals that are aware of their illness, Germany leads the pack, and the United States follows close behind, and Cuba trails behind. So, an overarching theme with all three countries is that men who have sex with men are most susceptible to HIV and AIDS. And another overarching theme is that mobile testing is very effective and popular for controlling HIV and AIDS. In the US and Germany, it's typically going to be a mobile testing unit like a van, but in Cuba, most preventative and home healthcare visits are in the home, so the testing would happen in the home. So, education is really important for controlling the disease. In the US, sex education is typically an abstinence only model, which isn't the most effective. In Germany and Cuba, we have some social media campaigns. Cuba has schools and TV ads. And in Germany, there's actually a hotline that any German can call for more information on HIV and AIDS. So the biggest difference is in Cuba, there is an optional quarantine for 8 weeks for HIV positive individuals, and about 50% of individuals do choose to participate. It's helped the country contain HIV spread to the lowest levels of any country in the Caribbean, but is this enough for Cuba to compete with the US and Germany? And unfortunately, the answer is no. So unfortunately, Cuba has been dealing with supply shortages for condoms and pharmaceuticals in the past 5 to 10 years, and this has has resulted in incidence rates rising. But what makes the US and Germany different? So, US healthcare is fragmented and German healthcare is not. Because Germany has that universal coverage, HIV positive Germans are able to get the care more reliably and accessibly than in the US. So, in conclusion, Germany has been able to manage the HIV/AIDS crisis most effectively of the three countries due to a consistent stream of resources and comprehensive coverage. I hope you learned something today. Thank you so much for coming along with me.